Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hi, everybody, and welcome back. Today we have with us Dr. Santina Wheat. I'm excited to talk to Tina about all the fun things that she's doing in our next generation of physicians and others. Welcome.
Thank you so much for having me. I'm happy to be here.
Perfect. Tell us about you.
Yeah, I am a family physician by training, and I have been practicing as a family physician and an educator for my entire career. And I have served in a lot of different roles with that. I've served as a site medical director. I served as a core faculty member during that time, and then also as a program director, and now a program director of a second program. And through all of that, I've had all of the ups and downs of what it is to be a female physician, a leader, and also a mom in all of this, and had lots of ups and downs with, was I happy in this job? Was I not happy in this job? And how to figure out how to get to my own purpose.
Yeah. And that's a lot of roles to have in addition to patient care.
Absolutely. That has been a plus and a minus. I think that sometimes the desire to be in leadership or to be in education can feel like it's extra work. But at the same time, if it's for the right person, if it's something that you enjoy, then it can really reground you in that purpose and also provide, in my case, some extra flexibility so that balance is a little bit more achievable.
Got it. Okay. So I was reading a post on Facebook just yesterday about
Mhm.
somebody in family medicine, and they were no lunch, no P stops, meeting at lunchtime, double booked patients, just really feeling the dread of being forgotten within this system, to be not considered as a human, as part of the cog of family medicine. Tell us a bit about things about your clinical days that were challenges and some of the things that you're noticing about ways we could be doing things differently.
Yeah, I think that's a great question, and one that I have to talk about with my residents as they're thinking about what is their full-time career going to be. I think that particularly in family medicine, we think it's our job to make sure that we're catching everything for everybody. And so that might be managing the things that the specialist has sent back to us or making sure that our patients get into the right specialist. Sometimes it's managing the paperwork that sometimes our specialist colleagues aren't going to do. They say that's our job, and it really makes you feel like there's not these positive pieces. And then sometimes I'll be in leadership meetings. Well, they're saying family medicine isn't bringing the money into the hospital. And so it adds this extra piece of, are we really not helpful in the grand scheme of things? On the good days, though, when you're able to realize that as the front line, the people that are really the trusted source of information, it can bring a lot of joy. It also is on the front line of being able to do the prevention. We will never have an exact number, but knowing that we're keeping people from having those MIs, from having those strokes with some of the prevention that we're able to do. I was just talking with one of my colleagues today about some of the interesting data that's come out even about prevention of cervical cancer by giving those vaccines, things that our pediatrician colleagues and us as family doctors are able to do for our patients. But I do feel like one of the things that I've always had to push against are the, can't you just add one more patient? Can't you just double book this person? Can't you add them in through your lunchtime? And that's something that I do as a leader is I'll say no for my team. I sometimes try to avoid them even having the opportunity to say yes to that because it's not manageable. And I really do believe that in order for us to provide the best care, to be the best for our patients and our teammates, we have to do the things that allow us to be sustainable in medicine and enjoy what we're doing. So avoiding those double bookings, avoiding those incorrectly scheduled patients where you get 15 minutes instead of 30 or 20 minutes instead of 40 as you're supposed to. And then also on the other side, making time in the schedule for things that we enjoy, being able to do the procedures that we love, or really being able to sit down and have those goal conversations with families, thinking through how can we strategize to ensure that those are there for each of us.
I found that comment fascinating that family medicine is just not bringing in the money. It's such, of course we're not, because if we're doing our role correctly, you will have less patients coming through your doors and you will have less money because we're doing a great job with trying to help our
Absolutely.
patients not end up in the system. And what's fascinating about that is if you invest in primary care, you will reduce the overall health budget because we're actually making such a massive impact in people's morbidity and mortality that
Yes.
for most countries around the world, like Canada and Australia, for instance, they want to reduce their health budget, whereas in the system where it's privatized and they want to increase the amount of money that they're making, primary care is not the way.
This
It's
is
literally the
so correct.
opposite the way to make money in the system because a good family doctor is going to cost less dollars to the healthcare system overall for that human's life.
Absolutely. It's so true. But yes, sure, the system brings in less money, but they also have to pay to do less of those things. Need less of the fancy equipment. We need less of the high cost medications. There's things that we can do to save them in the long run as well.
It's quite a hilarious side of things to be
Yes.
sitting in that boardroom listening to them complaining about us not bringing in enough money. I'm like, yeah, we're really doing a bad thing to your bottom dollar, but a good thing for our
Mhm.
patients.
Yes.
Okay, now, while we'd love to have chats about goals and we'd love to do some of those procedures, sometimes these appointment schedules are really out of somebody's domain to
Mhm.
control. So the system is just plugging it up with whatever calls in and it's booked months ahead of time. So if we're really sitting in that, the system has taken away that autonomy and reduced the ability for you to do the things you love to do. You were talking about, but we still need to look after us. We still need to have some ability to say no to the things that we are being asked to do in addition. That's hard. It's really hard to be, I can't take on that role, or do I really want to take on this role given how much I'm being pushed on to do these other things? How do you approach that?
I think that's a great question. And the first thing that I will say is stopping to pause, because I think that the thing that gets me in trouble or has gotten me in trouble in the past is responding too quickly and not thinking through how could I actually ask for what it is that I need? How could I gracefully say no in a way that makes sense because what they're asking for isn't helpful for the system? And in addition to that pause, it's really the looking at the other side of, as much as I'm doing this to support myself, support my learners, support my team, whatever that role is I'm in that moment, I have to think of the other side of how is what I'm asking actually good for the system too? Because when we can make it about our shared goals, then it makes it so much easier to ask for what it is. But I think that sometimes when we ask for those things, we are so in that reactive moment, that extra step is really hard to do. We're exhausted. We haven't had our food, like you said. I tell my residents always, before you have those difficult conversations, I want to make sure that you're rested and you're fed before you walk forward, because those are some of the little things. But I think showing up with how this benefits them with data can make this so much better. Maybe it's that you've noticed you're getting more patient complaints because the physicians don't have enough time. Maybe it's that you've noticed that your patients are complaining that they can't get in quickly enough. And sometimes using those two things can be a reason to say, maybe I need a smaller panel size, or maybe everybody in this team needs a smaller panel size, and we need to hire somebody else to be able to help us. There is so much work to go around that just dumping on the few people that are there it's not working. It's not working for any of us. But when we can show our patients are happier when schedules have a couple of same days in there, and also your physician retention is better because the physicians get to see their own patients and aren't having to read those consult notes later, then everybody really benefits from it. I'm fortunate to be at an organization that's looking at those things right now and having those exact conversations. So it really can work for leadership when you can take the step back and say, how can we make everybody in this situation happier? It's not going to be perfect. And I always assume that when I'm asking for these things, I'm going to ask for my ideal state, but also know that there's a reasonable state that I'll be happy with too. But I'm going to present as many options as I can in hopes of at least getting me to that state where most of us are going to be happy.
I love that. Is there anything else that you consider when you're thinking about a new role or some other ask?
So I really do always come back to alignment. And I was not good at this earlier in my career. I used to think that saying yes to everything that somebody put in front of me was the way to get ahead, was the way to get what it was that I needed. And I realized over time and with some coaching for myself, that meant that I was doing the things that I didn't enjoy. Even those additional roles that were supposed to be for my development ended up being one more checkbox along the way, which were not necessarily helpful and added to the lack of joy in the career and the desire to potentially look outside of medicine. I really want to help people find a way to stay in medicine when possible because we spent so much time working to get here. And
Mhm.
sure, medicine is not for everyone, so it's not the right answer. But for so many people, they really do want to figure out a way. And so finding those alignment pieces, the things that you really do love, I sat down and realized that education was something that I really loved. Do I love every single aspect of it? Absolutely not. Sometimes there's the times when I have to give hard feedback and my learners push against me, and those are the bad days, or they're the crises that don't ever go away. I'm never going to say that it's a perfect scenario, but I did realize that I really enjoy that, and I enjoy getting better at that. And so when I talk to people about how do they find more joy and sustainability in their lives, I asked them, what are the things that you were looking forward to when you wanted to become a physician? What were the things that you were looking forward to when you dreamed, when you were a little kid, when you thought anything was possible? And what of those things are you doing in your life right now? Sometimes if we take a step back and look at that, in my case, younger Tina, when you look back at the what was I hoping to do, it might not look exactly the same, but I used to say, I want to make it so that people understand their health. I want to make sure that people feel like they're heard. Those are two things that I get to do every day when I'm educating my family physician residents. I make sure that they get to feel heard and that they get to help explain healthcare to all of our patients. Are you doing those things that the younger version of you wanted to be doing? And so that's the biggest question that I start with, and then peel back the layers that are getting in the way.
Yeah. When did you decide you needed a coach? What was the sort of things that led you into this space of finding somebody to help you? What was going on?
Yeah, so I became a mom during residency. I came back from my second maternity leave into a leadership role, and I just kept going. I just kept thinking that this is what you're supposed to do to get ahead. So I just worked really hard. And my husband was the same way. We were really supportive of each other, but we were both in super busy careers. And then I was in this medical director role and I started to feel like things were not quite right anymore. The organization was changing and I no longer felt like I was leading. I was more becoming middle management, which is just a different experience. And then I unfortunately lost my mom to a fairly prolonged heart challenges. And when she passed, I didn't feel like I could make a change. I was worried about FMLA. I was worried about making sure that I had income while all of this was going on. And then after she passed, it took a breath and took stock of life. My husband and I thought about, were we going to move? Are we going to stay where we are? And decided we were going to stay. and I had the opportunity to become a program director. So I was able to take a change. But then COVID happened. And so I was a first year program director during COVID. And it was a constant barrage of being in the situation where I couldn't control everything, where things were changing every single day. And my residents weren't happy, my faculty weren't happy, I wasn't happy, and I wasn't sure that this was right. And my chair, she encouraged me to consider a women's wellness conference, and I started doing some digging. And it didn't always speak to me because I felt like a lot of things that people were saying were how to get out of medicine. And I was considering, did I need to leave medicine, honestly? But I really wanted a pathway that wasn't there. And so, in the spirit of being a good mentor for my team, I actually hired a coach for my residency program, who's a fabulous family physician, Tanya Kaler. And I brought her in for my team. And I wasn't sold for coaching yet, to be honest. And I, though, knew that I needed to model using this resource well and just understanding it. And going through that process did allow me to do some self-work. We did all group coaching actually. And I realized some things that I had never fully realized in some of the other development experiences that I had. And at the same time, my chair set me up for a leadership development for being a senior leader in GME within family medicine. And between those two things, I was really able to get some one-on-one support, really able to think about things differently and slow down. And then circumstances changed at my program. I realized it was not a good place for me anymore, that I had grown a bit. And I really dug down and invested in myself. I did coach training myself, and that actually forces you to go through a whole lot of self-enlightenment. And it really reinforced for me that I love medicine, that I love education, and I love creating things. And so was able to do that in my new role as a program director for a different program, and then also in supporting others externally.
Yeah, yeah. What were your residents and you learning under that group coaching with Tonya that was changing your day or your experience of medicine?
I think that some of it was the way we take feedback. I realized, at least for myself, that some of the feedback that I was taking from the residents, I was taking as you're bad, as opposed to the situation is not what I was hoping for. And I felt like when I went in as a program director, the thing that I will tell new program directors when I talk to them now, if I run into them, is I made this mistake of thinking that in order to be always available, I had to answer immediately. And
Mhm.
that one misconception was probably one of the key drivers to send me into burnout. And it was for
Mhm.
a few reasons. I was doing it for my patients. So I was the quick person on the My Chart message. I was the quick person to call them back. I was answering my phone at all hours of the day when my residents would call. It wasn't actually emergency. It was just that they were up at that time and forgot that I wasn't up at that time. And I was responding to emails very quickly. It was like a knee-jerk reaction, which is why I jumped. And I realized that I didn't have to do that. Sometimes if I waited even 2 minutes, somebody else responded and I didn't have to do it. Or the person responded back and was like, oops, I found it. Never mind. I don't need to bother you. So I just learned that I could still be very available without doing the immediate responses. I would say that's probably the biggest lesson that I learned from her in that time.
Yeah. I was actually talking to some physicians recently, and one of their top tips for each other was don't be the one that answers the message directly,
Mhm.
because that just creates increasing and increasing volume. Redirect it through ancillary staff at the clinic in regards to patient care so that it is understood how to wisely use this portal, and it is not a direct access to you at all hours. Otherwise, you just
Mhm.
create infinite requests. Like,
It is
no,
so
that's
true.
example of a good boundary setting right there.
It's so true. And I do tell my patients, I say the easiest way to get a hold of me is the My Chart, especially as a program director. I'm not in clinic all that much, but I tell them, but just so you know, it goes through my nurses. So you cannot expect me to respond immediately. You have to expect at least 24 hours for it to get to me and it to be the time that I'm at EMR that day.
Yeah, that's right. So some of those system that says we respond within 72 hours is not you. The doctor will be getting back to them within 72. Some human might see it within 72 hours of arriving in the
Correct.
inbox.
Correct.
Just understanding, what does that actually mean? So good. All right.
Absolutely.
So you learned some things and your residents were learning things. What are the residents saying about this whole experience of having someone coming in and helping them to see things in a different way? Because you've obviously thought that's important. I'm going to go do that too, because that really helped. What were you noticing initially with that for them?
I think that it didn't necessarily help them in their moment of the day to day. But what
Hmm.
it did allow for them was it allowed them to think through what were their next steps and what were the things that they really cared about. And so the cadre of residents that I did this for first, they also had, they could choose up to a certain amount of one-on-one, as I mentioned. And many of them used it for their job decisions. And it was amazing that this was able to happen because, of course, faculty do a great job of counseling on jobs, but some faculty have only ever known one organization. And so to get an outsider's perspective of what can you actually be thinking about as you're doing this? What do other organizations have out there? Is really a beneficial thing. And what are the pieces that are actually part of residency that are going to go away? And what are the pieces that are part of medicine that are never going to go away? And then just take all of that and think through, what do I want my day to look like? And so Tanya was able to do that for some of my residents in a way that some of my faculty could not,
Hmm.
because they were also invested in wanting them to come work at our organization because they wanted them as colleagues, or they hadn't experienced some of the other things that might have been out there, or they didn't have a framework for private practice or for other things because they'd only been in academics. And so I think having someone that could walk through with the what is your purpose? What is your alignment? That also had no real stake in the game was amazing for them.
Yeah. Now, how have you incorporated any or some of those things into your current program?
Yeah, so I love some of the coaching things that I've been able to use. I've been able to really lean back into to curiosity more often. I find that now that I have some of these tools, when you get to the program director's office, there's usually a problem. So usually you're coming to me not with wonderful things. It might be that you're worried about something or somebody else is worried about you, or we're in some sort of disciplinary action. And so I jokingly, but not jokingly, tell them I always have tissue and chocolate in my office to help them through. But we're always able to take a step back and think of, what is it that's actually going on? And what is it that you're intending to happen? And I couldn't do that 5 years ago. I was too reactive. I was more dealing with what is the problem right now. But I really have been able to be able to use terms like, you're not showing up as your best self. What's going on? And it just hits a little bit differently than the you're not doing, you're not showing up on time, or you're not doing the patient care that you're supposed to, or we're worried about the medical knowledge, or you're not doing what you're supposed to. And so the conversations just flow so much differently. And it allows me to have real forward thinking conversations with them about, okay, so some of these challenges that you face in residency aren't going to go away. Being a little bit crankier with your peers when you're tired, that's probably a you thing that's never going to go away. A lot of us have that thing. How are we going to manage that? Or how are you going to manage that when you're not in residency? How are you going to manage that as you're moving forward, particularly as you go through the different stages of life? And so being able to have some of those conversations, that's not part of the evaluation that I write for my residents, but being able to help them think through how am I going to use this, the things that I've learned now to be sustainable in my long-term career, that really gets me excited. It makes me happy that they can use those tools moving forward.
Yeah, yeah. What are some of the things you advocate for conditions of work for your residents that help them be successful and sustainable in their careers?
So I will say I am super lucky. I am at an organization that really puts trainee wellness very, very high. So they do get access to free coaching, actually. They get their sick days and they get to go to their physician's appointments or therapy appointments during the workday. And it's not counting against them in their vacation or sick time. So they get a fair number of resources that I think are really things that I wish I would have had when I was in a trainee. I went to the same organization and I've just watched it advance over time. But I do also advocate for things like, do we have a schedule that makes sense that allows for time to recovery? And when they are away from clinic, particularly as family docs, the work piles up. And when they're on a inpatient rotation and away from clinic, then that work really piles up and that adds to their cognitive load and the other times that they're doing things. So last year I changed the schedule so that they're not away from clinic quite as long, so that they have that time, they have that continuity with their patients. It sounds like a sort of silly thing, but structurally over time, it really did help them feel sustained throughout. We're having conversations right now about like the day-to-days of charting, of course, are fun. When can residents use potential AI scribes? When can they do those things? They do actually already have the ability to use Dragon in all of their spaces, but in thinking through how can they do some of that, and also providing some documentation support of if you don't learn how to manage your inbox and your charting early, you spend a long time trying to figure that out in your career. So we do a fair amount of education for them early on for what are the things that you absolutely need to do for this to be billed and to help that person that's coming in after you. So really trying to teach them to triage some of that earlier in their time with us so that it becomes a little bit more sustainable.
Yeah, and then it makes sense if you're out of family medicine for weeks and weeks, or even a
Hmm.
week, that inbox
Hmm.
doesn't stop. Even to go to a
Nope.
meeting, the inbox doesn't stop. And if it has to be you, I like that you thought about how do we help them be able to continue this care for their patients? Or if it has to be 4 weeks out, who could do it instead of you? Who
It's
else?
interesting. Yeah, it's interesting that you say that. I actually proposed that they come up with a coverage schedule, but they don't love that. And so that's one of the next things that I'm interested in. I feel like there's physicians, we are trained to be a little bit controlling. We want to have control over all of our things, and letting go is one of those things that many of us are not wonderful at. And so they worry that somebody else isn't going to take care of their patient the way that they will, or they're not going to document the way that they will. And so that is one of the strategies that I'm thinking about for the future of how do we ingrain that a little bit more to invite more of that team collaboration, because I also think that's really important for sustainability, but that one has been a little bit of a harder nut to crack at the moment.
Yeah, and this is part of good systems. If we don't trust a
Hmm.
system, then we won't use it. So team-based care does require that we actually all do inbox in a similar way so that we
Right.
know that if there's something on that scan that it needs repeating, that will be
Hmm.
handled well at the beginning when it's first noticed so that it isn't forgotten in the future. You're right. It takes more than just saying, hey, your colleagues are going to do that for you. It's no, pause. Why wouldn't you use that? What do we
Hmm.
need to create within our environment so that we can trust that will happen for our patients, for them well? So our residents in our clinic are only there for a year. So I'm teaching them now. You need to do this
Hmm.
in this way because you're not here next year. And when this CT's due again, that's going to be me. And if you don't set this up,
Right.
that patient is lost to follow up, and that's on you. And how do we start to set you up for success, set the patient up for success, and set the
Hmm.
people to follow you up for success so that this is done uniformly in a way that
Yes.
we know that the safety nets exist for this patient. And so they know they're temporary staff to our
Yeah.
organization. And how do we start from the beginning to set them up for success? Yeah.
It's so important. And it's not just that. It's the watching. residents or faculty members feel like they can't go on vacation without checking their inbox whether that's not good for anybody. I want you to go on vacation. I want you to enjoy yourself and come back
That's right.
well. We have
Yeah.
to, the systems have to be there for emergencies and the planned. And so absolutely those systems are key.
Yeah, I love that. Anything else we haven't talked about that we should be considering?
I'm intrigued right now, particularly as an educator, that we have a new generation that's coming in. And so being prepared for innovation, being prepared for shifting norms, going back to that statement that I made before of physicians like control and like to do things their way, we really do need to be open to the idea of the way that we've been doing it for however many years is not necessarily going to stay that way and is not necessarily the best way. And everybody's talking about AI right now. Maybe it's that, maybe it's going to be something else in 3 years. I don't know. But as we were watching a new generation come in and enter the workforce, I think that we're going to have to adapt and be malleable during this time as well.
See a lot of the newer generation. I've seen it in my own residence. They had time off for sickness. And I was so happy to be able to say, yes, I don't want you here while you're sick.
Yes.
Knowing that my mentors were there sick or
Mhm.
post-op, like within days of being post-op, would still be at work. So seeing that shift of what was I shown as a resident and what am I
Yes.
seeing in my residence now about
Yes.
even that is different. The fact that they can just say, I'm not coming in, and I'm like, okay, we'll handle it.
Yeah, it's a totally different experience. I still, like I mentioned, my residents have a fairly generous policy for that. And sometimes when we tell their rotations that they're not going to be there, I do get that nobody called off during my day. And I'm like, okay, but that wasn't healthy. We learned that wasn't healthy.
I'm going to go take a year off and come back and I'll be better. As what? We stopped the treadmill?
It can happen. It can happen.
Fascinating. So good.
Absolutely.
Yeah. Yeah. Okay. So starting to have some flexibility of our thinking, pivoting of our thinking to say that what has happened before is not what's going forward. Now, what does medicine look like in this new generation of our colleagues coming through? They're going to be creating new ways of working, new rules for engagement that looks different to how we've done it.
Absolutely. And it's not just them. Our patients are asking for different things sometimes too. And so we're going to have to adapt on both ends.
That's so true. Have you got an example of that?
Oh, I feel like I'm getting a fair amount of the I saw on social media, and I feel like I see a lot of talk about this and the different physician groups of frustration about that. And I try to remind at least my learners that it's coming from someplace. It's coming from we didn't provide this for them, or the system, not we as in this healthcare system has not made it easy to understand this, or there's still so many things that we don't understand. And so that tends to get written off. And when a patient comes in with that, if we can meet them where they are about that, then that's really important. And then there's the other piece of I have a 13-year-old and a 10-year-old, so they've known nothing but the digital life and they order things that show up the next day. And that's just the on-demand culture that they live in. And so waiting 6 months to see the doctor seems ridiculous to them. What do you mean we can't call Dr. Paul and see him tomorrow? And so there's this push-pull that we're watching happening between the on-demand of what patients want and then also us being better, I think. I don't think we're perfect yet, but I think we're better about physician wellness and knowing that there have to be boundaries and limits there. Those two things don't actually align very well. And so we have to figure out systems that allow for both of those and continue to adapt.
Yeah,
But,
you're right. These are tricky problems. You're right. I'm gonna order my doctor's appointment online. Now that's happened in the last few years for sure. Or I'm gonna
mhm,
send my doctor a message. That's a new ish. Not for some
mhm.
systems it's been there for a while, but for other systems it's new since COVID at least. There are definitely changes we've seen from the patient perspective. What do you mean I have to wait for that? You're so right. And our system
Mhm.
isn't ready for that and
Mm.
doesn't have adaptive processes or enough spaces to be able to deal with a lot of the I need them today requests.
Yeah. But I
Yeah.
also feel like the COVID meant that we didn't talk to people in the same way. And I do feel like we're getting back, or I hope that we're getting back to that. And at least I find when I talk to my patients, they understand and they can be mindful that there's a person on the other side. But you have to have that conversation and explain it.
Yeah, but even the ability to see patients electronically, like through a portal, on a phone call, through a video, there's technology that's come into play that does make our access easier, though sometimes
Yes.
our boundaries are then pushed.
Yes.
But then some systems are trying to lose that again, the ability to see people by phone or by video. I'm and I'm curious about that. Why would we step backwards from that when that created increased flexibility and access potentials, which make it easier for patients and therefore potentially improve patient care? Not always, some things need to be seen in person, but
Right.
sometimes that can make access so much faster and
It
more kind.
can, and it means that our patients aren't mad because they're not waiting for you. And when they can take a 30-minute break at work as opposed to coming to the office for 3 hours, it's meaningful. It's
Mm-hmm.
meaningful.
Yeah. Yeah.
These are joys.
Things about the system. All right. How do people find you if they're looking to connect more with the things that you're doing?
Absolutely. You can find me on my website. It's my name, www.santinawheat.com. And then you can find me in LinkedIn with my name, Santina Wheat. And then also can find me on Instagram as Tina Wheat, Dr. Tina Wheat.
Okay. And what do you offer out to the world that's beyond your program director? What does that look like?
Yeah, I do offer primarily wellness and career coaching, primarily for those of us in healthcare, because it's what I know the most, but really anybody who feels highly driven and wants support with that. I do a lot of focus on purpose because I feel like that's the core of where I start and boundaries. And so I offer a free 7-day boundary challenge and a free alignment workbook to help you determine if working with me is something that's helpful.
Great. And is there any take-home messages that you would like to leave us with before we end today?
Sure. I think that the key to so many things of determining what your next steps are really that pause to really to be able to stop and take stock of what's going on around you and how you actually want to respond. When you can pause and avoid the reactiveness, it makes the joy so much easier.
I love that. Thank you so much for this conversation, Tina,
Thank you for having me. I've loved it.
and have a wonderful week, everybody. See you next time. Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast, and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have charting champions for physicians and smarter charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.